Hi, I'm Brian Lefferts. I'm a community volunteer, a coach, and a concerned citizen. My family relies on public health. All of us rely on public health. It keeps our community safe and strong. Just imagine waking up tomorrow only to find that the health services your family depends on are gone. No vaccines for your children, no clinic in your community, no emergency teams ready when disaster strikes. That's not just a distant possibility. There's a very real danger that this could happen right now because of a quiet proposal moving through Washington. Next year's Department of Health and Human Services budget, put out by the Office of Personnel Management, proposes huge cuts that would decimate our public health infrastructure. If Congress accepts these cuts, we could face a future with fewer vaccines for our kids, rural health clinics closing their doors for good, slower responses to natural disasters and disease outbreaks, and less support for maternal health, for seniors, and for mental health services. Let's be clear, when these services disappear, it's not lobbyists in Washington who are going to feel the pain. It's our families, it's our friends, it's our neighbors who rely on these programs every single day to survive and thrive who are going to suffer. The proposed budget cuts funding by 44% for the Centers for Disease Control and Prevention, 40% for the National Institutes of Health, and 19% for the Food and Drug Administration. This means fewer staff for inspecting food safety and medical products, eliminating early child care and education programs, and reducing lead monitoring for schools. Programs that keep rural hospitals and clinics open and staffed will see significant cuts, and many will be forced to close. Approval for new therapies and treatments will be delayed or stopped while patients continue to suffer waiting for new treatments. New mothers will bring their babies to well child appointments to find clinics closed, and seniors from small towns won't be able to see their doctors because the nearest clinic is closed and the nearest facility may now be hours away. Public health isn't a luxury. It's a basic component of a functioning society. To be clear, if these cuts happen, people will die, and the impacts of these cuts will be felt for decades. But there's good news. We are not powerless. Congress still has a choice, and you have a voice. By contacting your elected representatives today, you can tell them no changes to the FY26 HHS budget. Protect our communities. Protect our health. It just takes a few minutes to call, email, or show up at a town hall meeting, but your action could protect healthcare for millions of Americans. And when you act, you inspire others to act too. Together, we can be louder than the lobbyists, stronger than the budget cuts. We can stand up for what's right. When public health is fully funded, we all benefit. Our kids stay healthy. Our grandparents receive the care they need, and our communities stay strong. But we only keep these protections if we fight for them. Please take action today. Call, email, speak out. Tell Congress, fully fund HHS. No cuts, no compromises. Because every family deserves a future where healthcare is a right, not a privilege. And that future starts with the action you take today. Together, let's protect public health and protect each other.